Thank you all for coming today, and we will begin our discussion on vitamin supplementation. So what are vitamins? I think there's so many supplements out there that we're losing track of what's a vitamin and what are other nutrients or minerals or trace elements. Vitamins we have are commonly the ones that we recognize as vitamins are vitamin A, B, C, D, E, and K. Now, of each of these vitamins, there are different subsets, but these are the broad categories. In vitamin B, there are 8 subvitamins that we will be discussing. Vitamin D, I gave a previous discussion on about a year and a half ago, and that is already on the YouTube site. Calcium, iron, zinc, all of those are not considered vitamins, but they are important cofactors for the effects of some of these vitamins. So everything in our body kind of works together, and I'll touch on some of that. Some of the resources that I used for today's session included the NIH Office of Dietary Supplements, and they've got an amazing alphabetical list of supplements and vitamins for you to research. They have it for patient-facing fact sheets as well as for healthcare providers. And then Harvard is doing something similarly, and they tend to update their fact sheet. So they take information from here and then they add more to it. So I've got both resources if anybody wants anything more specific. And then, of course, things that from my practice as well as other literature. So the goals of today, we're going to just talk a little bit about aging and how vitamin absorption changes with that. Just one slide on that. But we're going to discuss all the different vitamins I listed. We're going to just run the alphabet. What is it? What does it do? Who needs it? What are the risks and pros and cons of taking these? And then we'll talk about kind of what are the indications and dosages. So as we get older, everything thins, including the lining of our stomach. And vitamin absorption occurs in different parts of the stomach, the small intestine, and even the large intestine. So if we take a look at just, this is kind of a straight line, and really everything is kind of wrapped in there, but this is a way to list all the different parts of the intestines that work to absorb vitamins and nutrients. Most of the vitamins, vitamin A, D, E, and K, are absorbed in the duodenum, and many others in the jejunum and ileum. So these are all the small intestine, but work has to start in the stomach and even up in our mouth and swallowing. Nothing is absorbed in the esophagus, but breakdown occurs in the stomach and then passes through the small intestine, where fat molecules will help absorb the fat soluble vitamins, which is in this area, and then water soluble items later in the intestine. And the reason it's important to know that some vitamins are fat soluble and others are water soluble is because of how they're going to react in water or with fats and stored. So let's talk about vitamin A, which is a grouping of fat soluble retinoids, which is something that I know a lot of people are very interested in terms of topical retin A, anti-cancer, anti-wrinkle functions. It's involved in cellular communication, growth and development, male and female reproduction. It maintains normal function of our heart, lung, eyes, and other vital organs. It's critical for vision because it's an essential component of rhodopsin, which is a light-sensitive protein in the eye. And that's why we commonly think of vitamin A as the eye vitamin. But because it's fat soluble, it can get stored and lead to toxicity, which we'll talk about. A deficiency, we don't see that very much in the US. but in developing countries, we can see night blindness. And if women don't have adequate dietary intakes in developing countries, their fetus will have abnormal lung development. In severe deficiencies, recurrent pneumonias, in increased severities of other infections, anemia. You can see irregular patches on the whites of the eyes, dry skin, or dry hair, and an overall increase in mortality. Who is at risk? Infants, children, pregnant people without adequate dietary intake, patients who have cystic fibrosis, which affects the mucus and glands in our body and causes a malabsorption, so you can't absorb fats. And so, but nowadays we have treatments for CF, and so we're seeing less of that. But previously, cystic fibrosis patients had to be supplemented in a different way. People with Crohn's and ulcerative colitis have inflamed bowels. So if we go back to how much absorption occurs in our GI tract, and if all of that is swollen or inflamed or irritated, you'll see decrease in absorption. What can it help with? Well, the ARIDS trials have shown that it may decrease age-related, a certain type of macular degeneration and measles. So how can we get vitamin A? It's, as I said before, it's a fat-soluble vitamin stored in the liver. We can measure blood levels, and the recommended dose is about 700 to 900 micrograms a day. Well, if you look at some common foods that are high in vitamin A, beef liver, just a few ounces, will give you 6,500 micrograms. I mean, you need a bite of that and it'll last you the month. Sweet potatoes are high in vitamin A. Spinach will give you 60%, and that's just half a cup boiled. Pumpkin pie is also a good source. Carrots, about 50%, a half a cup of raw carrots. And then everything else is kind of in the 20s. So dietary sources of nutrients are the best, depends on how they're prepared, cooked, stored. Old vegetables lose their nutrient content compared with fresh. So dairy is also a good source. And then here's an interesting caveat. Cod liver oil. Many people have started taking it for the vitamin D content, but it's also provides the daily allowance for your vitamin A. Vitamin A has a provitamin, so you don't have to take A in and of itself. So all the carrots and tomatoes they're considered, all the orange and yellow fruits and vegetables are high in carotenoids. And those are a provitamin for vitamin A, and they will then convert into vitamin A in your body. I have a quick question. Daily doses as an average, monthly pulses for some, actually daily for others. So I think I'll try to incorporate that into, most of this is average daily doses. We don't prescribe vitamins in a monthly form unless we're giving you shots. There are certain things that we do to our body that decreases fat absorption, such as weight loss drugs. Orlistat is one that decreases fat absorption, and it can therefore decrease our vitamin A levels. Now, what about too much toxicity? We have to think about vitamins and overdoing it, and especially our fat-soluble vitamins, vitamin A, vitamin D, vitamin E, vitamin K. So our vitamin toxicity, vitamin A toxicity actually has a name, hypervitaminosis A. And if you take too much, you can get headaches, blurred vision, nausea, muscle aches, even an increased pressure in the fluid in the brain, bone pain, and light sensitivity. So too much can actually make us more sensitive to light. Dry skin, depression, fatigue, abnormal liver tests over time, since it is stored in the liver. There is an increased risk for lung cancer in a study. And actually, I have one patient about 30 years ago was in the ATRA trial looking at vitamin A as a COPD prevention. And that study was stopped. But it was a long time ago looked at, well, maybe it can help. But due to increased risks for lung cancer associated, it is definitely not advised. And there are now medicines used in dermatology that have a lot of vitamin A in it. And we have to keep in mind that if you are taking a supplement with vitamin A and then taking it for medicinal purposes, you can get toxicity. So now let's go into the vitamin Bs, which are all water-soluble vitamins, often found in fortified cereal. We're going to start with thiamine, which is vitamin B1. It is important in our energy, metabolism, growth and development, and the function of our cells. It's absorbed in our small intestine, stored a little bit in the liver, but not very much because it's water soluble. We'll urinate it right out. So that therefore we need a continuous supply. So you cannot like pre-dose this monthly. The metabolite serves as an essential cofactor for 5 different enzymes involved in sugar, protein, and fat metabolism. We can measure it in the blood, but because it moves so fast in our system, it's not necessarily reliable. But if we're noticing somebody is super low, we can check the urine. And if your urine levels are low, it means that you're absorbing a ton and not secreting it. It means you need it. Age, like I mentioned, as we get older, we absorb things less. In the nutritional guidelines, everything is age over 50, and that's the cutoff for elderly. And so I just showed, since I'm with you here, the recommended daily allowance. The lower values that I cite are for women and the higher ones are for men. So there is a sex difference. Women need less than men do due to their metabolism and size and muscle activity. So what happens if we don't get enough thiamine? We get weight loss, anorexia, muscle weakness, confusion, short-term memory loss. There is a disease called beriberi, which is heart failure. Peripheral neuropathy can occur, and it may play a role in memory loss and Alzheimer's. Most people do get adequate amounts of thiamine. However, we do know that it's estimated up to 20 to 30% of older adults who are taking a bunch of different medicines and due to aging and perhaps lower nutritional intake are impacted by thiamine deficiency. People with HIV or AIDS, because they have malabsorption from the GI tract and have wasting muscles, are at risk. People who have diabetes are at risk for thiamine deficiency. People who have had gastric bypass surgery as well. And then I'm hoping that I mentioned and then also people who have all the malabsorption symptoms I mentioned, and people who are alcoholics we see with thiamine deficiency. Sources of B1 are, it's supplemented in most of our cereals. So we've got our daily intake right there at 100% if you're eating a fortified breakfast cereal, which a lot of people aren't doing due to the carb content. But enriched noodles and other foods only serve thiamine in about 25 to 40% of the daily recommended dose. But, you know, people eat more than, you know, they'll eat a few different things. at a time in a day and added up will have enough thiamine. It's important to know that heating foods can reduce your thiamine content by 20 to 30%. So certain foods that you've heated up too much. If you're boiling things or vegetables, a lot is lost in the water since this is a water soluble vitamin. So when the water is thrown out, a lot of vitamins go out with it. And then processed foods, highly processed foods that you're eating can alter thiamine levels. If you're taking a supplement, it usually contains about 1.5 milligrams of thiamine. Interestingly, certain foods and beverages like tea, shellfish, clams, raw fish contain enzymes that deactivate your thiamine. But it's rare to develop a deficiency because you're eating these or drinking like tea. But so we just have to keep that in mind. But it was just kind of an interesting factoid that I thought I'd throw out. Let's switch to B2, riboflavin, another essential component in that plays roles in energy production and metabolism of our fats, drugs, steroids in our body. The body absorbs very little riboflavin through a supplement beyond 27 milligrams. Bacteria in our large intestine produces free riboflavin. And interestingly, more is produced after we eat vegetables than if we ate meat. Riboflavin is light sensitive, so it's lost when it's exposed to light. Most riboflavin is used immediately and we don't store it, and excess is excreted in the urine. So if you're taking too much riboflavin, your urine can become bright yellow in a supplement. The RDA for women, 1.1 milligrams and 1.3 for males over 51. What happens if we don't get enough B2 or riboflavin? It can cause thyroid problems, skin disorders, a discoloration of the skin that looks like you have too much blood in there, flowing there, swelling of the mouth or throat, lesions at the corner of the mouth. This is rare here. Cracked lips, hair loss, itchy red eyes, and then nerve and liver degeneration if it's very severe. This is a nutrient that is very rare to find alone in deficient states. It would be usually if you're missing other vitamin Bs as well. Who's at risk? We are starting to see vegetarian athletes. So remember I said muscles and level of activities, especially if you are vegan. Pregnant and lactating women who don't consume dairy or meats, which is in the developing countries. And then a rare disorder called riboflavin transporter deficiency. It's very rare, but that's how we find some of the symptoms of riboflavin deficiency. There are two areas that are being studied is in pregnancy and in migraine prevention. So some naturopaths are starting to say, well, take riboflavin to prevent migraines. There are no known drug vitamin interactions just because it goes through our body so quickly. Sources are, again, there's that beef liver, which is over 200% of your daily recommended dosing. The cereals are fortified with exactly what you need for the daily requirement. Oats, 85% in yogurt and milk. So dairy is a good source because just 2 cups of milk or a cup of yogurt, which we recommend for the calcium and bone health, and as a probiotic, gives you 50%, and then just an oatmeal or something else will give you some more. So you'll get an adequate supply. Now, I mentioned the light sensitivity of riboflavin, and it is in dairy. So if but that food source is exposed to too much light, any riboflavin in that food will be deactivated. So milk should be typically, if people were wondering why it's not sold in clear glass bottles anymore, It's because the light will deactivate the riboflavin. Pasteurization and heating can deactivate some nutrients and vitamins. So buy your milk in cartons or opaque containers to block light. I am starting to see more glass bottles at certain stores, and I tend not to buy my milk in the glass bottles. Sorry about that. So now vitamin B3, niacin, and I'll try to speed it up so we can get all the way to vitamin K. All the tissues in our body convert niacin into its active form that we need for everything we do, which is in a form called NAD, nicotinamide adenine dinucleotide. It is the cofactor to create ATP and energy in our body. So hugely important. It's needed for gene expression, genomic integrity, cellular communication, muscle building. Our body can also convert tryptophan to NAD. So we have other pathways into NAD. Please don't think that we would be designed to just be dependent on this one little molecule. Excess niacin is stored as part of our red cells or excreted in the urine, but it's not fat soluble, so it's not a lot is stored. Deficiencies, there is a disease that we know exists when mostly sailors historically, China, India, everybody discovered very early on that there is a nutrient deficiency if you don't get fresh vegetables or fruits, or were predominantly fed rice when they were deployed. And that was something called pellagra. And you saw skin discoloration, bright red tongue, nausea, constipation, diarrhea, depression, apathy, fatigue, paranoia, hallucinations, memory loss. And all of this ultimately led to anorexia and death. We don't see that anymore, and it is supplemented in our cereals. Who's at risk? Well, we do see, I hate to point out, but we do have an impoverished population that's visible and living in tents all over the cities. They are at risk. People who drink a lot of alcohol and don't get nourishment, people with AIDS, inflammatory bowel disease, or liver cirrhosis. If you don't get enough of your vitamins, less iron or iron, then less is converted to niacin. There's a rare genetic disorder, Hartneff's disease, that interferes with tryptophan absorption, and then we see a decrease in NAD and then decrease in muscle and energy. There are drugs that interrupt the production of niacin, such as INH, and anti-diabetes medicines can impact niacin and lead to higher sugars. And there is something called carcinoid syndrome, where that causes your transfer into tryptophan, and then not as much niacin is formed. And niacin is believed to protect brain cells from stress and injury. Sources, 14 to 18 milligrams is the range. This is for 14 milligrams a day for women, 15 for men, 16 to 17 lactating, and up to 18 for pregnant women. Supplements beyond the RDA can cause skin flushing. So niacin, niaspan used for high cholesterol, or red yeast rice. Often people have had skin flushing and they stop that supplement. They think they're taking it because for the triglycerides, and studies are showing that it's not that great for it. Again, there's beef liver, which I don't think I've ever consumed, but high in niacin. Chicken breast, as shown here, tomato sauce, turkey breast, tuna, and then everything else is in like 10 to 30%. And all these slides are going to be available to you, so you can reference them anytime you like. For vitamin B5, which is pantothenic acid, it is an essential nutrient in the synthesis of a coenzyme A, and it's involved in most of our biologic functions. We do not usually measure this in the blood, and it's recommended to take this at 5 to 7 milligrams a day, 5 for women, 6 for men, 7 if you're pregnant and lactating. It's in almost all plant and animal-based foods. And so that's why there's no true RDA or toxicity or even deficiency that we notice. The body absorbs about 40 to 60% from the dietary sources. However, food processing can decrease this nutrient by up to 80%. So like I mentioned before, deficiency is extremely rare. And there's been, just based on experiences of prisoners of war in World War II and studies of diets lacking pantothenic acid, the deficiency is, the symptoms would be numbness, burning of the hands and feet, headache, fatigue, irritability, kind of some of the other symptoms we've mentioned before with the other Bs. There is a rare, of course, there's a genetic disorder that with the deficiency, and that can lead to, and found in babies, and severe neurodegenerative disease. And so that's how they find out. Average diet contains about 6 milligrams. There's no risk for excess toxicity because it is water soluble and doesn't interact with any drugs. So if you get breakfast cereal or even sunflower seeds or some nuts or anything, you're getting your pantothenic acid and lots of vegetables and you're fine. Let's talk about B6, which is pyridoxine. It's involved in more than 100 enzymatic reactions in our body, absorbed in the jejunum. We can measure this in the blood and the urine. And the recommended daily allowance for women is 1.5 milligrams and for men up to 1.7. Deficiency is, we do see this as deficiency, and it's associated with anemia, decline in your immune function, swollen tongue, depression, confusion, and again, the lips. Who's at risk? Now, this is interesting. People who have renal insufficiency or renal failure are at risk for this deficiency. People who have rheumatoid arthritis, people who have celiac disease, Crohn's, ulcerative colitis, and any inflammatory bowel disease, people who are dependent on alcohol. Everybody was saying, well, we need to be supplementing this, and for cancer prevention, no benefit was seen. But there may be some benefit in ameliorating PMS symptoms or with morning sickness in pregnant women. However, this should be done, if you're pregnant, should be monitored and discussed with your obstetrician. Sources: chickpeas have moved to #1, beat out beef liver. So, and it can provide up to 65% of the daily recommendation. 26 to 36% of the US population, or 28 to 36, takes a supplement that has B6 in it. However, even 11% of supplement users will still have a low level of B6. 24% of adults who don't take a supplement are estimated to be low in B6. So it's interesting, it's a common deficiency. We do check this, especially for people who complain about neuropathy. Low B6 levels are usually associated with B12 and folate deficiency. So it's not common to be an isolated B6 deficiency. So we check for other things. Interestingly, overconsumption of B6 to mega doses can lead in an unsteady gait. There are drug vitamin B6 interactions. Cycloserine, which is a chemotherapy agent, increases urinary excretion of B6. Anti-epileptic drugs increases breakdown of B6 and then raises our homocysteine levels, which then homocysteine is an independently known substance in our body that's an inflammatory marker. B6 supplementation in children on Keppra may decrease side effects. So there's a beneficial effect of B6 in a small population. And theophylline, which I used to use a ton of for my COPD patients, reduced B6 levels and increased irritability and seizure risks. We don't use theophylline that much anymore. Biotin. I did receive an email request to discuss biotin. It is, again, involved in fatty acid, glucose, amino acid metabolism, which are the big three for our bodies. Biotin also plays a role in what we call histone modifications, which is part of our building blocks, gene regulations, cell signaling. It's hard to measure. Adequate intake is approximately 30 micrograms for anybody over age 19. And a recommended dietary allowance doesn't exist for biotin because there's not enough evidence to suggest a daily amount is needed by most healthy people. So this is kind of a little different, but we hear so much about biotin. What happens if we don't get enough? Signs and symptoms appear very gradual, and it can include thinning of the hair to progression of loss of all hair on the body. You can get a scaly red rash around the eyes, nose, mouth, perineum, red eyes. There's an acidosis that can occur, and increased uric acid in the urine, seizures, skin infection, brittle nails, and lots of neurologic symptoms, depression, fatigue, hallucinations, tingling in the extremities. Sources, it's not easily consumed if you look at this list, unless you're eating about 3 eggs a day, which I don't advise because many people have cholesterol issues. And we're probably not eating beef liver. And then if you go down to salmon, it's only 17% of our recommended daily allowance. And then everything else is just really very small. Interestingly, raw egg whites will decrease your biotin absorption, but if you cook it, you're fine. So most supplements have the RDA and it's 100% absorbed. So in this setting, having biotin in your vitamins is a good idea. Average intake in the Western diet is about 35 to 70 micrograms a day. Who's at risk? Well, of course, there is a genetic disorder where you can't process biotin, and those folks are at risk. Chronic alcohol use. 15% of people with alcoholism will have deficiencies of biotin. Estimated 30% of pregnant women will have a decrease in biotin, and people taking anti-epileptics have a reduction of biotin levels. So let's talk biotin in hair. It's everywhere. It's mass marketed. Small studies support a benefit, but to date, there's a lack of good evidence that shows that it's beneficial for growth, that supplements are beneficial if you're getting adequate dietary intake. The interesting thing, because it's now so ubiquitous, everybody's probably on a biotin type supplement for hair, skin, and nails. And I should know about it so that I can tell you to hold your vitamin dose 24 hours prior to any blood work. Now, the main risk of that is not that biotin interferes with any blood test in your body. It's that the lab uses a biotin streptavidin technology to measure certain blood tests that we order, like thyroid function, troponins when we're wondering if somebody's had a heart stress or a heart attack, or even your vitamin D level. So if you hold your vitamin, your biotin or your B complex vitamin 24 hours prior to the blood draw, remember it's water soluble, it's going to be urinated out within 24 hours, then you go to the lab and get your blood test, it'll reflect a more accurate level for the thyroid test or vitamin D. And Troponin, unfortunately, we're usually doing that in an emergency setting, so you had no choice there but to let your doctor know. Now, B9, which is folate, we don't commonly think of it as B9. We just think of folate as folate. Folate is a very important substrate for DNA, RNA formation and metabolism of amino acids. It's digested and what we call hydrolyzed in the stomach, broken down in the stomach, and then absorbed in the intestine. We do measure that in blood levels, and the recommended daily allowance is about 400 micrograms a day. In 1998, the FDA began requiring manufacturers to add 140 micrograms per 100 gram of bread or flour to enrich bread, cereal, flours, cornmeals, pasta, rice. And just recently they put it into corn masa just because of the deficiencies that we find, and reduces the risk of neural tube defects for pregnant women and our babies that are born. So B9 deficiency doesn't usually happen all by itself. It coexists with other nutrient deficiencies because of a poor diet, chronic alcoholism, or malabsorption, which, remember, if the gut can't absorb nutrients due to inflammation, then it's not going to absorb B9. And again, similar symptoms: tongue and ulceration, anemia, changes in skin, hair, nail pigmentation, and it can elevate that homocysteine level, which is inflammatory. Who is at risk? Alcohol use disorder. Now, alcohol directly interferes with folate absorption and liver uptake. It increases folate breakdown, and it speeds up renal excretion of folate. And so about 60% of people who are heavy alcohol users will have folate deficiency. And those in healthcare, remember, whenever we're seeing a patient who we suspect of alcohol withdrawal, we hang the banana bag because it's all yellow, and that's why it's called, and it has thiamine and folate and other B vitamins. Moderate alcohol consumption, interestingly, 1 8-ounce glass of red wine a day or a 2.7-ounce vodka drink a day for 2 weeks can decrease blood levels sufficiently in healthy men to below sufficient levels. So I shouldn't use that word sufficiently. It can significantly decrease blood levels so that you don't get enough, so that you're below normal. Pregnant women are at risk, again, malabsorption. And then there is an interesting, this is a genetic disorder, MTHFR, methyl tetrahydrofolate reductase deficiency, that converts folate to an active metabolite. It's estimated 25% of Hispanics and 10% of Caucasians have this genetic polymorphism. And many times we supplement with folate to override that deficiency. But now we're finding that that doesn't change anything because you can't convert it, that there's a supplement, and it's over the counter, called 5-MTHF. And that may be a better way to kind of override that propensity. Anybody interested, we can always check for that for you. Sources of folate, there's beef liver again. Supplements are a good source. 85% is bioavailable if you take your supplement with food, 100% if you take it on an empty stomach. Most people in the US have adequate levels because they get, a variety of fortified products. And let's look at its impact on our health. Folate's being looked at for all of these disorders: autism, cancer, cardiovascular disease, stroke, dementia, cognitive function, memory loss, Alzheimer's, depression. And we do know its association with neural tube defects. So folate is an important brain supplement. And that's why the FDA has gotten involved and mandated certain levels in fortification. Now we're seeing people kind of overdo it on the other end. What if you take too much, which is over 1,000 micrograms? So that made me go to my bottle and just make sure it wasn't anywhere near this amount. May increase risk for colorectal cancer, may negatively impact our immune system. And most importantly, if you're taking too much folate and you have this B12 deficiency or anemia, it may mask that. We do know that it interferes with methotrexate if your methotrexate is being used as an anti-cancer drug, but it does help with side effects if methotrexate's been taken, if you're taking it for rheumatoid arthritis. So often methotrexate is given with folate in our RA patients. Anti-epileptics, again, reduce folate levels. And then many IBD patients with Crohn's or ulcerative colitis are on sulfasalazine, and it inhibits our intestinal folate absorption. So there are things we do in healthcare that decreases your vitamin absorption. And it's important for all of us to know that. Now, B12, a very important vitamin that's water soluble, is required for helping the development of the coating on our nerve cells. So it's called myelination. In the function of our central nervous system, it's involved for healthy red cell formation and synthesis of DNA. B12 is bound to a protein in food and must be released from that food to be absorbed. So B12 process begins in our mouth when food is mixed with saliva. It starts to break down. More is released when that food B12 meets the gastric juices. So the hydrochloric acid in our gastric juices that helps bring it down. It break it down and then combines with something in our gut called intrinsic factor. And you need intrinsic factor to help bring B12 into your body through the distal ileum. We do measure B12 levels in the blood, and the recommended daily allowance is about 2.4 micrograms a day, very little. When I test the blood for B12 levels, the range is 194 to 912 as a normal range. I like to keep everybody over 300 because just in the last 3 months, studies are showing that low B12 levels, less than 300, are associated with later onset development of maybe Parkinson's disease. It is estimated 20% of adults have a B12 deficiency. And 30% of men and women in the US are taking a supplement that has B12. If you don't, and we are seeing pernicious anemia, dementia, neuropathy due to B12 deficiencies. Measuring B12 in the blood is not always the best way to determine if somebody's truly deficient, because sometimes it's water soluble, you may have a spike, but we do other tests, methylmalonic acid, or even test homocysteine levels. If the homocysteine is high, then I know that you're deficient in other B vitamins. And by supplementing, we can try to bring that inflammatory marker down. So who's at risk? People who have had surgery, any type of surgery on the stomach, prolonged use of PPIs, which is so ubiquitous, people on metformin or who aren't getting enough in their diet. Bariatric surgery is a huge risk factor for most of our vitamin deficiencies because part of the gut, now that you know how much is absorbed through the GI system, and if we cut that out or bypass it, you're going to be at a loss for absorption. You just don't have the landscape to absorb the vitamins. So we have to supplement. Vegetarians or infants of vegan women. And again, GI disorders that reduce intrinsic factor. And I've just got a little factoids here that are interesting. Extra supplements of B12, unless you're deficient and have low energy, then when we supplement you guys notice a difference in your energy, but supplementing at a healthy level does not improve energy. They used to say vegans take brewer's yeast. Doesn't even have enough B12 in it. They also said that the nori, the purple layer of dried edible seaweed to make sushi rolls, is a plant source of B12. It doesn't contain enough active B12. You can read this later at your leisure. So again, here's beef liver, 3,000% of your needed B12 content. Now, I have to tell you, this is not in my plant-based diet. So a supplement is something that I do. Just know that your rate of absorption is about 50% of the dose of B12 you swallow, and it depends on intrinsic factors. So if you're taking a supplement, your rate of absorption may be half. So that's why we tend to give more as a number to take, because only half of it is even going in. There are many forms of B12, sublingual tablets, lozenges, bypassing the stomach and giving you a shot. And interestingly, there's a prescription nasal gel spray. I've never ordered that. Let's skip to vitamin C, another water-soluble vitamin. We cannot make vitamin C out of other things like animals can. It's an essential dietary nutrient to help build collagen, help heal wounds. It's an antioxidant. It helps in regenerating vitamin E in our system. May help prevent cancer, heart disease, and others. That's a Linus Pauling thing. It definitely helps us in our iron absorption, and we know if we don't get enough, leads to a disease called scurvy. Let's talk about absorption. It enters our cells with the glucose transporter. Approximately 70-90% of vitamin C is absorbed if you take 30 to 180 milligrams a day. But if you're taking over a gram, which is in a lot of these big vitamin C tablets, your absorption decreases to 50%, and the rest is excreted in the urine. High levels are maintained in our white blood cells, eyes, adrenal glands, brain, and pituitary gland. So the RDA is about 75 milligrams for women, 90 milligrams for men. And you have to add 35 extra if you're an active smoker, because the nicotine and tobacco use decreases your vitamin C absorption. We do know a ton about vitamin C deficiency just because of what fruit wasn't sent with sailors a long time ago. And if you don't get adequate vitamin C within 1 month of, sorry about that other typo, you can get fatigue, lethargy, gum bleeding, weakness, bruising, joint pain, poor wound healing, and then something called corkscrew hairs, that over a long period of time, more than a month, then you'll start seeing more anemia, loss of teeth, and bone disease. Who's at risk? Smokers. They have lower plasma vitamin C levels due to a lot of the stresses due to tobacco use. And one would argue, well, why not all the other vitamins? Yes, but vitamin C more than others. Infants fed non-formula milk. So there are infants fed boiled milk or non-fortified milk in other countries, and they are at risk for vitamin C deficiency. If your diet is limited or you have poor food availability or variety, and then again, malabsorption. So many foods are fortified with vitamin C. You'll see that when you're buying your orange juice. If you've had foods prolonged in storage in your refrigerator, or you cook your foods that are high in vitamin C, you will reduce that content significantly because vitamin C is destroyed in heat. It's best to consume your fruits and vegetables raw if you're doing it for your vitamin C. Supplements are typically in the form of the ascorbic acid, which is equivalent to in bioavailability to orange juice and broccoli. Now let's talk about the health benefits. It's of question in terms of cancer prevention. It's better to eat your fruits and vegetables than to take the supplement. In cancer treatment by Linus Pauling, it was proven to be of uncertain benefit and may interact with chemotherapy and radiation. So anybody taking most people who have been diagnosed with cancer are advised not to take vitamin C because it interferes with those treatments. It's of questionable benefit in helping with macular degeneration. However, in the common cold, it may help those who are elderly, smokers, and may shorten the duration of cold symptoms. Vitamin C serums and skin creams are very popular because of its impact on the collagen, but research suggests that it's very little benefit. And I mean, I've seen price tags of like $80 to $100 for these vitamin C serums, and nothing goes through the skin there. So if you've got an adequate intake, you don't need those serums. And then high doses of vitamin C can actually increase your risk of heart disease, kidney stones, and even increase iron absorption, which can lead to iron overload, especially if there is a genetic predisposition to something called hemochromatosis. And it may affect HDL levels if a person's taking a statin. Let's talk about vitamin E, which is a fat-soluble vitamin, and it has 8 subset of different chemical forms. Alpha tocopherol is the only form that humans can use. So that's what we're going to talk about. It's converted in our liver. It's considered an antioxidant. It's fat-soluble, stored. We can get toxic. And it's involved in keeping our immune systems healthy. Our recommended daily allowance is about just 15 milligrams a day. Up until a few years ago, they used to report it in IUs, and now it's been changed to the milligrams. So most supplements have an adequate amount, more than adequate amount, and higher than the RDA. Vitamin E deficiency is very rare unless there is like cystic fibrosis or other significant malabsorption disorder, which when people have that, they know. And it can lead to neuropathy, vision change, immune dysfunction, gait imbalance. This supplement can interfere with antiplatelet medications, increase bleeding if you're on Coumadin. It blunts the HDL rise if you're on a statin, and it also may impact efficacy of chemotherapy. That's of a question mark. So let's talk about vitamin E, because about 15, 18 years ago, maybe even 20 years ago, everybody was on vitamin E, thought it was going to help with wound healing, reduce their coronary heart disease risk, and study after study showing no decrease in heart disease or heart failure, and actually increases that risk. Can increase the risk of hemorrhagic stroke because of its bleeding effect, may increase prostate cancer risk. They're still looking at it in ARIDS, which is this supplement that many people with macular degeneration use. And that was studied, but that was studied as a multivitamin supplement that had carotenoids in it, which when you remember vitamin A was helping with the visual. So vitamin E may not help in macular degeneration. Now, dietary sources of vitamin E may help prevent Alzheimer's, but not as an added supplement. And 2 clinical trials have found an increased risk of a stroke, a bleeding stroke. But they're re-looking at vitamin E and optimal dosing because these studies were all mixed. There is no increase in mortality, just the prevention of these diseases is not of any benefit. Vitamin K, our last vitamin we'll talk about, thank you for hanging in there, is found in green leafy vegetables. It's a coenzyme in a lot of blood clotting and bone metabolism. It's also fat soluble, but very little circulates in the blood because it's rapidly metabolized and then excreted. The body only retains 30 to 40% of whatever vitamin K you've ingested, and it's not commonly measured. And there is a recommended daily allowance of about 90 to 120 micrograms a day. Sources of vitamin K, it's available in dietary supplements at less than 75% of the RDA. If you look at this, I learned something new in preparation for this talk, is that there's a substance called natto, I hope I'm saying it correctly, which is a fermented soybeans that's very commonly used as a paste in Japan. 700% of your daily recommended allowance. So it's high in vitamin K. Collard greens, turnip greens, spinach, all have plenty of vitamin K, kale, broccoli. So anything kind of green here, you're doing well. If you're going to have your greens, and remember, vitamin K is fat soluble, so it's best to eat your vitamin K foods with a little fat to improve absorption, whether it's with some olive oil in the dressing, throw some avocado on your salad, or even some cheese so that you've got some fat to carry your vitamin K into your system. So vitamin K and health. Newborns, did you know that all our newborns get 1 dose of vitamin K at birth, because pregnant women don't pass vitamin K through the placenta, and there used to be a disease of bleeding in the newborns. So now, to stop that, 1 dose of vitamin K is given to all newborns. Osteoporosis in Japan, vitamin K is used in that form I mentioned, and they actually give vitamin K as a drug, and it's been shown to improve bone density. So I'm seeing a lot of people come in with bone health supplements for osteoporosis prevention that have calcium, D, and K in it, and it's because of this, from Japan. Coronary heart disease, deficiency of vitamin K may cause increased coronary calcifications, but we don't have enough data to date. We do see a ton of drug interactions. So long time ago, before all our new blood thinners were out, we used warfarin a lot, Coumadin. Now, we told people don't eat green leafy vegetables because it could decrease your effect of the blood thinner warfarin. And we used vitamin K to kind of reverse the effects of warfarin. So it does help it make the blood sticky if you're on the blood thinner. Antibiotics it kills the bacteria that help absorb our vitamin K, and so we get vitamin K deficient while you're on antibiotics. There are some bile acid sequestrants, so things that would decrease our fat absorption, or orlistat again, will then take out the cofactor that we need to absorb vitamin K. So then we'll see some deficiencies, and we can pick that up, not by directly measuring the level, but by other blood tests. So here is a slide summarizing kind of all the vitamins we've talked about, kind of what we use it for, what are some good dietary sources, and then how to have a healthy plate of food. And so that dietary sources are the best sources. Sometimes we just, for whatever reason, can't eat this much food in a day, don't have the time, energy, taste buds for all of this. So we do need to supplement, which leads to an article that just came out last week from Harvard that says your memory might benefit from a multivitamin. So if you noticed, a lot of the data I said previously was 20 to 30% of Americans are deficient in one form of a B vitamin or another nutrient than others. So that might be why memory might benefit from the supplement. And so more to follow. But the researcher said healthy lifestyle needs to come first. You can't just take that and fill this glass with wine and say your memory's going to benefit. Um, he Many people ask me, what do I take? These are the supplements that I own, and I take it kind of on a rotating basis, um, depending on what I'm doing that day. Exercise, I'll take my vitamin and a vitamin D. Coming to work, I take airborne so that I'm strong enough to fight off anything that gets coughed on me. And then the Nutrafol is to get over the stress of 2 years of COVID stress and hair loss, which Nutrafol has probably way too much of a lot of different vitamins that I mentioned. And so I use it sparingly. I take it on an empty stomach, and I also suspect that not all of my vitamins are absorbed. So it's important to just know that even though you're taking it, it feels like a lot, you kind of mix it up. You know, your body, if you're in tune, knows what it needs when it needs it. And it will kind of say, oh, I'm looking at this vitamin and I'm feeling nauseated. Okay, don't take it that day. It's okay. So the purpose of this talk was, what vitamin should you take? Well, as you can tell, it depends on your diet, exercise, medications, your lifestyle habits, and underlying medical conditions. Here's some recommendations. Don't take the mega vitamins that are sold in the multi packs. Those are just too much and too many pills all at once. We need to mix it up in our vitamins between chewables and tablets, just like our foods. Avoid vitamin E supplementation. A good B complex is important for neurologic function. Use chewables if you don't like some of the tablets. Keep in mind, men and women's RDAs differ, so don't take your husband's products and don't take your wife's products. I tend to prefer non-GMO organic products. And I can measure many of your levels, review your medications, talk about your stomach and lining and inflammation, and then we can try to figure out what would be the best kind of regimen for you. And that concludes today's discussion and record time. I appreciate your attention.